Access to medication and gender dysphoria are just some of the challenges facing the transgender community during the 21-day lockdown. Gender dysphoria refers to the anxiety felt by someone who's transitioning from their assigned sex at birth to their preferred gender. But in KwaZulu-Natal, help is available to keep transgender men and women living their authentic lives, even in lockdown. I want to bring in our reporter in KwaZulu-Natal, Minoshni Pillay, to tell us more. Minoshni, a very good morning to you.
Good morning, Blaine.
Look, you've been working on this story for a while now, and it's raised some concerns about how this already vulnerable community is facing the lockdown at home. Some, can find themselves in an unsafe environment, an unsafe family environment with people who, I guess, do not accept their gender diversity. Tell us more. What did you learn?
So, like you said, there are those in the transgender community that will experience a very stressful time in this 21-day lockdown. However, there are also members of the transgender community that have exceptionally supportive families and that will thrive in this period. But it's those that do not have the support that is of real concern, that in this 21-day lockdown, they will find themselves with people that have not accepted their decision to transition, and there will be bouts of anger, confusion, depression, extreme anxiety. And I spoke to a 24-year-old young transgender woman, Sazi Jali, from Umlazi in Durban. Now, she was assigned male at birth, but identifies as a strong, positive, young transgender woman. And she has also started a nonprofit organization called Trans Hope, designed to offer hope and support for members of the transgender community, especially the youth, that will find themselves battling and grappling with a lot of emotions in this time. Let's just take a listen to some of the challenges that she's told us about that they will be battling at home, confined in a lockdown period.
All right, Minoshni, I think we don't have that clip quite just queued up yet. We'll try to queue up that clip in a short while, but just summarize, what she's going through in this regard.
So she gave me a really descriptive example. For instance, you're a young student that's been staying away at residence, and you've now come home for this 21-day lockdown period, and especially in rural areas where there's lots of members of your extended family that may be living with you. And for instance, she says one of her colleagues has said to her that their mother said to them, during this 21 days while your granny is staying with us, perhaps just wear that dress, wear that skirt so that we don't rock the boat in this period. And that will lead to a lot of stress and tension for people that may be in the middle of a transition, really unsure of themselves, or those that were very confident in their journey, now being forced to perhaps revert to behavior that is not in keeping with their authentic self.
Yeah, Beno, these clips are not quite ready, but so you'll just give us a sense of what they're all about. We believe that access to healthcare and medication for transgender people are not easy in general. What is the situation now in this 21-day period? Can they access their regular doctors and medication from an ordinary pharmacy, so to speak?
So if you have a script, there are certain kinds of hormone replacement therapy that can be accessed from a regular pharmacy. The problem comes in with transgender individuals that are transitioning and need to follow a very strict regimented protocol in terms of therapy that is critical and necessary for the guidelines of transitioning. And Sazi spoke to me very basically about the lockdown regulations regarding public transport. There is one public healthcare facility in KwaZulu-Natal at a public healthcare level that caters for transgender individuals with a trained clinical psychology team, a trained endocrinologist, two critical professional medical elements necessary for a transgender individual. Now, how does an individual staying in remote rural parts of KwaZulu-Natal within these very restricted public transport traveling periods make their way to this one facility in KwaZulu-Natal. Obviously, there are individuals that can access private healthcare, hormone replacement therapists and medication, but this obviously costs a lot of money.
Yeah, look, it's an uncertain time that we're going through, Minoshni. I mean, we all need support during this time. We talk about physical distancing, but having that social connection in order to get us through this. So what sort of support is there for transgender people in KwaZulu-Natal during this time? What options do they have during this lockdown?
So apart from Trans Hope that SABC is working on, I came across an amazing individual, a clinical psychologist, Chris McLaughlin. And at this point, allow me to switch to the respected pronoun, which is they, when referring to Chris. They operate out of this Pietermaritzburg-based public healthcare facility. And Chris is a trained clinical psychologist.
Yeah.
She's worked with over 100 gender diverse and trans individuals going through gender affirming treatment. And Chris has told me that she is available every day during this lockdown period on WhatsApp, on teleconferencing, continuing therapy sessions, and actually asking her patients to guide her in their needs during this period. She's also spoken about transgender individuals that are in a very critical period of their transitioning, that the lockdown should not stop this, that the work should continue, that to stop that work right now would be further confusing for them. So she's really spoken to us about the constant support that she's using technology to get to her patients.
We continue to pull back the curtain, Minoshni, and give you a window into the struggles people are going through during this lockdown, real stories that will hopefully help streamline the COVID-19 strategy. Minoshni Pillay, SABC news reporter, we thank you very much indeed for your reporting. All right.